Hey everybody, if you found this video useful or interesting in any way, please give me a like and subscribe. That would help out a lot for the growth of this channel, and it'll let me know that I'm doing something that you enjoy. All right? See ya. We've got another major topic on performance today, and that is recovery. This is something that is a massively popular topic, and there's a lot of technology that's come out, and a lot of influencers have done a great job of marketing certain projects and different things related to recovery. So it has become an area for a lot of people to make a lot of money and create a lot of narratives around it, of course, because whenever there's a lot of money involved, there's a lot of beliefs involved, and that kind of helps the situation unfold a little bit more, so to speak. So let's first talk about some of the things that don't matter necessarily as much with performance with training, or their effect. Realistically, it's more that their effect compared to other things is not as valuable or not as effective. Okay. So if it was like, think of it as a scale of 1 to 10. 10 would be the thing that could make you recover the most. These things are generally going to give you like a 2 or 3. Okay. And if you already have the 10 covered, then the 3 might be more important. But if you don't even have the 10 covered, the 3 is not really going to make that big of a difference, or it's going to be so marginal that it's like you aren't really recovering, because physiology doesn't necessarily care that you're doing like a little bit of recovery when you need a lot of recovery, right? So that's one of the big issues that people kind of run into. So anyway, what are some of the things that are not necessarily as important? There's a ton of things. This includes massage guns, foam rollers, ice baths, saunas, supplements, supplements that aren't necessarily directly related to like carb intake and protein intake. Okay. So all of the other supplements generally have less of an effect overall. It's harder to kind of get into the research with some of the supplements, but generally speaking, that's kind of the reality. But a lot of people really believe about like ice baths and saunas, and they say, I feel better after. And one thing people don't necessarily understand with the sensations related to recovery or feeling better versus some of the physiological adaptations that are occurring, is that sensations can be affected by a number of different things. Obviously, if you drink alcohol, you have a sensation. You might feel less sore if you drink alcohol, but does that mean you're physiologically recovering better? No, not at all. In fact, the opposite would be true. Alcohol can actually stunt some of the recovery effects that happen with full rest and full sleep and protein synthesis and things like that. But you might get less of a sensation of having pain related to an injury or a training session because you drank alcohol. And the same thing can be said when it comes to foam rolling or massage guns or manual therapy or ice baths and all that kind of thing, because you are affecting something on the there's different levels of the nervous system, but there's certain things related to kind of topical nerves where you can kind of blunt some of the effects, right? And that's very common when it's related to like ice and massage, and that includes kind of foam rolling and that kind of thing. So does that stuff help in recovery? Again, this is where we're looking at it as a scale of most recoverable to least. And this is something that does less. All right. So it isn't like it's a zero sum kind of thing where this stuff doesn't do anything. But it's like if you aren't taking care of the big blocks, then it's less important. So what are the big blocks outside of the modalities? The big blocks are obviously rest. Okay. So this is both between session, and then also overall accumulation of rest. So if you are always training in high volume, okay, like let's say, for instance, you're always training 4 sets of 20, like every session, and you're doing 4 or 5 sessions a week, you're accumulating fatigue over time, okay? So week to week to week, you're going to accumulate fatigue, and then you might need to strategize days where you do less volume or even no volume to kind of mediate some of that recovery. But then it's also going to be time off of training completely. So this is time getting sleep. This is time relaxing, reducing stress. This is time that we can use to hydrate and make sure that we're getting all of our macro needs as well, which your macro needs are a part of recovery strategy. So if you're insufficient in protein and carbs, obviously it's going to be very difficult for your body to just make up those needs. You might always be at a deficit and be breaking down, especially at the amino acid level where we're trying to replace some of the proteins that we're using in exercise or training. And we need to have a sufficient amount to, again, mediate some of that recovery, because you're using proteins in normal daily function, and you're using carbs or glucose in normal daily function, and then you're going to be using it more, obviously, when you're training hard, when you're training intensely, and you're doing lots of volume. So that's kind of like the big block. How do you strategize with training methods? So outside of making sure that you're getting enough sleep, which sleep needs, we've found more and more through the research, like we've generally kind of built this time frame that says like 7 to 9 hours is a good sleep range, right? But we've found over time that there is an individual variability related to sleep requirements. And then outside of just the time associated with sleep, it needs to be restful sleep. So this needs to be, relaxed, consistent sleep throughout the night versus interrupted sleep and different kinds of things that kind of affect your sleep. So that stuff is a little bit more important than just purely the number of hours. And that's something I think a lot of people get wrong. They just kind of assume that if you get 9 hours of sleep and you're waking up every couple hours, you're still okay. It's not necessarily that straightforward. And there's still research that's developing around sleep in a lot of different aspects, not just in the performance space. But what are some strategies? So the more you train in higher volumes, the more you're going to be increasing overall fatigue. So you can train some high intensity sessions. So some sessions where you're, at 80% of your 1RM, or if you're using an RPE or RIR, reps in reserve scale, you can have that be, within 2 to 3 reps in reserve, or at like a 7 or 8 in your RPE, and consistently you can have fairly quick ability to turn over in 24 hours and be able to train again at a similar scale. Not necessarily the same muscle group. Like you want to be kind of careful with, if you're back squatting and then you back squat the next day, obviously you're going to be accumulating fatigue because that's still volume accumulation for the same muscle groups and the same motor unit recruitment and all that kind of stuff, the same demands as far as working those same skills, right? So that's where you want to be a little bit more strategic with some of that stuff. But again, we've seen that accumulating volume over time, number of sets, higher volume of those sets. So like doing lots and lots and lots of reps. I know that it's something that's in the bodybuilding space. Obviously, there's some augmentation being done in bodybuilding. So it's really hard for Joe Schmo to go into a gym and hit the same number of sets that somebody who's supplementing, using, substances to assist with their recovery and their training volume. What would I say? Their ability to train at higher volumes. you can't necessarily equate it all, right? So like purely saying because someone who's really famous was able to do a high number of volume, like one, there's individual demands and resilience to high volume or low volume. And then there's going to be some of that, obviously, that's going to change depending on if somebody's using drugs or not. So hopefully that was really informative for recovery. There's a lot of misinformation out there on it. If there's anything more we can cover in depth here, go ahead and let me know in the comments and we will touch on it.